Almost everyone loves a good nap, right? But for this man, the naps just didn't feel right. Turns out he had a serious problem. We'll show you what your sleep can tell you about your heart.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday, I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. Coming up today, a sleep study can reveal valuable information about your heart, and it sure did in this case. What doctors saw that raised alarms. Plus, what if sudden cardiac arrest wasn't so sudden? We're going to share the warning signs you can look out for 24 hours in advance coming up a little bit later in the program. And of course, you, our viewers, are the heartbeat of this program. We love answering your questions. You can tweet them to us or send them to us in real time on YouTube, Facebook, and at the All Things Heart email. You'll find all the links right there on your screen. Now to Joe Davis. Joe knew he wasn't feeling his best, but he didn't know why. It turns out he wasn't sleeping well because of a serious disorder, and he never expected the impact it was having on his heart. Janine Kiesling takes us through Joe's journey from Indiana here to the University of Kansas Health System, where he finally found answers and help.
Up here's where I do the greasy work of disassembly.
At 80 years old, Joe Davis refuses to slow down.
This is a 70 Cutlass convertible. My oldest boy and I restored.
When Joe moved to Kansas from Indiana, he gave his new doctors at the University of Kansas Health System his health history, including the irregular heartbeat detected before his hip replacement. While it hadn't raised alarms for his Indiana doctors, it did for the doctors here. They ordered a series of tests revealing Joe's arteries were more than 85% blocked. One was almost 98% blocked.
They told me that this was what they would call the silent heart attack, a widowmaker.
Joe underwent a successful quadruple bypass surgery, and Joe being Joe, he went right back to doing his thing.
I still keep very active. I just don't think about it. I don't let it ruin my body, but I don't let it run my life.
Still, Joe noticed post-surgery that he was more winded than normal. Something else very un-Joe-like, he was napping during the day. Doctors ordered a sleep study, something he says he never would have considered on his own. The studies showed Joe had sleep apnea, a disorder, doctors said, put a real strain on his heart.
There's a direct correlation. If you don't get enough oxygen, if you're not breathing properly, you're not sleeping properly, your heart can't do its job.
Doctors diagnosed Joe with AFib, an irregular heartbeat. He now wears a mask when he sleeps and says those afternoon naps he took every day are for the birds. Because Joe feels better than he has in years.
Love seeing stories like that. We want to welcome Joe Davis to today's program, along with his sleep medicine specialist, Dr. Saurav Luthra. And we're also joined by cardiologist, Dr. Shannon Hoos-Thompson. Dr. Hoos-Thompson, you didn't treat Joe, but you are here to help us understand the impact that his sleep disorder was having on his heart. Thank you for joining us. Joe, I want to start with you. First of all, you must be feeling good. You just got back from vacation. You spent quite a bit of time in South Dakota.
Correct. We had a very good time. The wife has always wanted to see Mount Rushmore.
Nice.
We've been out there and visited Badlands, Custer State Park, up into the Ellis Tower, Crazy Horse. We spent about 5 days out there camping in the Blackwood Hills Forest.
Oh, that sounds wonderful. So you're feeling great now, but let's talk about what was happening during the day. Back when you weren't very well, your heart rate was dropping. What did that feel like?
Technically, I never did feel the heart dropping. I could never noticed it at all. The only problem is I felt fatigued and I felt like sleeping. This trip, I drove 800 miles in 2 days and really never got even the least bit tired. I really enjoyed the trips. Never did feel the low heart rate. They could tell me I had it, but I never really did feel it.
So you went to get the sleep study because of you were napping more than often. What is a sleep study like? Because in my mind, I picture it, someone hooked up to a bunch of wires and then doctors watching you with clipboards through a window while you sleep.
The sleep study, the first one did not go very well.
Yeah.
It took almost all night to get the correct machine, get the, since the type of sleep apnea I had is not the normal type. They call it central sleep apnea. It's not obstructive.
Are you hooked up to wires?
The first one I thought was a total disaster and almost didn't go back, but I was convinced to go back for a second sleep study. Once they had the correct settings on the machine and the correct mask, everything went well. I had the best night's sleep then. Once I got the machine, I've worn it. It was last August the 8th, I think I started. And I've worn it almost every night except when I had COVID. It has really helped me immensely.
Can you feel a difference when you don't wear the mask? Is it a CPAP you're wearing now?
That type of machine. It's an ASV machine rather than a CPAP. I can't say that I do. I do in the morning. If I take it off and lay there just for a few minutes, I can tell that it is a little harder to breathe than it is with the mask and everything on. But as far as sleeping without it, I really, like I said, the only time I did is when we had COVID, and there was other things going on, so I really didn't pay much attention.
Dr. Luthra, during a sleep study, are you watching the person the whole night? Are they hooked up to cords? What happens during the actual study?
So you can have two types of sleep studies, Alexis. We can have a home sleep apnea test, and in that case, you are just wearing the kit at home. Those kits are having a lot less wires. Nowadays, we have a test in which you don't even have any lead close to the nose to monitor the airflow. You just have a pulse device, a wrist device, and a chest band. And the other type of study, which is a study done in the lab, that is more sophisticated. So you do have some leads measuring your airflow, measuring your EEG data from your brain, and you are not continuously watching as a physician the patient. There are sleep technicians there overnight. Patients are in their private room, and the technicians are watching from a different room, a monitoring room, from which they look at all the recordings.
So you diagnosed Joe with something called central sleep apnea. How is that different from other sleep apneas? What is that?
So central sleep apnea is a type of sleep apnea in which you don't have a mechanical obstruction in your airway that decreases the airflow. You actually have the brain not sending impulses to breathe. So there is no breathing impulse several times an hour and probably 100 times over a night. That drops your oxygen level, and it affects a number of different organ systems in the body.
You shared some images with us from Joe's sleep study, so I want you to help us understand what these mean. This image we're showing now is before Joe began using a device to help him, correct?
Correct, yeah. This is the image So this is a hypnogram. So this is sort of a graphical representation of the different sleep stages, body position, oxygen data, and the breathing events. And this is the snapshot we had when he did the first sleep study, which he was describing did not go well. So on the top bar, you can see all that green line is how many times he was awake. So he was pretty much awake all night. And on the bar below the red one, where you see all the brown marks, those are all the central apneas he had. So basically all through the night, he was having central apneas, and he was awake all night, and he did not feel great.
Jeez. And then we want to show the next image. This is the image taken after Joe began using the device to help him sleep.
Correct. Yeah. So this is the image when we tried the ASV, which is the adaptive servo-ventilated device with him. And you can see all those brown marks are gone. The central apneas were treated. He did get more yellow lines and the red lines, which is your deep sleep and your REM, rapid eye movement sleep. So that night he slept a lot better. His central apneas were treated and overall looked like a much better picture.
So when Joe says the first sleep study didn't go well, was that because he had such a miserable night sleeping having those episodes, or does it sometimes take more than once to get an accurate reading?
So because in central sleep apnea, we have certain devices we have to try, starting from a CPAP, then going to BiPAP. The first night may not go well because we may not find any optimal settings for patient for central sleep apnea. In those patients, the second night, typically we are able to try the ASV device and it goes well. But that is not the case with all patients. If patients have more obstructive apnea or more mixed apnea, even the first night we may be able to find something that works for them and they still may have a good experience in one night.
Okay, and then Dr. Hoos-Thompson, I'm going to get to you in 1 second. One more question, though, for Dr. Luthra. What's the name of the device that Joe uses now? What kind
so it's called ASV, Adaptive Servo Ventilator. It is a type of positive airway pressure device, basically indistinguishable in terms of how the patient experiences it from CPAP. The difference is in the algorithm, in the way the pressure is delivered through the same mask that you would wear with a CPAP.
Okay, so Dr. Hoos-Thompson, as a cardiologist, help us understand how, if someone has sleep apnea, this is impacting their heart.
It impacts the heart in several ways. First off, good morning to everybody.
Good morning.
I love treating sleep apnea versus 12 years ago when I started out as a cardiologist, how kind of crude or limited we were, whereas it is very much an evolving science and the impact is just unmeasurable. From a heart standpoint, the two most common things we see, or when I start to look for sleep apnea as a cardiologist, is one, arrhythmias, especially atrial fibrillation, or even low heart rates, really low heart rates at sleep where they actually have pauses or breaks in their heart rate or heartbeat. And the second thing is resistant hypertension. When we start treating high blood pressure and they get to a point where their general doctor says, hey, you need to go see a specialist like a cardiologist and discuss high blood pressure and why we're not responding to typical medicine and therapy, one of the things I routinely look for is sleep apnea, because a lot of times if somebody has untreated sleep apnea, then their blood pressure just doesn't stay controlled. And if you're not treating atrial fibrillation, if you're not managing high blood pressure, then again, the risk for heart failure, the risk for stroke, the risk for coronary artery disease and heart attacks goes up dramatically. So this has really been an important treatment and breakthrough in science. And when you hear about Joe's story and hearing Dr. Luthra speak, you can see how refined we now have become as far as being a lot more specific with how we treat people and can adjust therapies going forward.
And Joe, you've really been through the ringer. You had a lot of things going on health-wise. So Dr. Luthra, is the sleep apnea in any way, could it be connected to the fact that Joe already had heart surgery? Like, could this be, sleep apnea be a side effect from heart surgery?
Likely not. I think it is more of an effect of his heart disease, we can say. Central sleep apnea is a type of apnea where it develops when you either have a brain condition or a cardiac condition or a neuromuscular condition. So in his case, because he had the heart disease, that changes the dynamics of the blood flow in the body. And when the blood flow slows down or flows differently, the sensors in the body do not sense when our CO2 is going up, when our oxygen is going down, and that affects the breathing regulation. And that's why, because of heart disease, his breathing regulation was affected, which is why he was having those pauses in his breathing at night.
Okay, and then Dr. Hoos-Thompson, Joe was diagnosed with AFib, atrial fibrillation, but he says he didn't feel many of those symptoms. Is it common to have AFib and not recognize or feel symptoms?
Yeah, absolutely. It can present in a lot of different ways, and it's not always symptomatic or significantly symptomatic, and be more vague. So the answer is yes, to keep it simple.
Okay. And then, Joe, what are you doing to treat the AFib?
Right now, they're monitoring it every 6 months. I go to the heart specialist at KU, and everything so far has been fine. He told me if I watch it, if I feel lightheaded or nauseous, I should let them know. But right now, it's been almost a year, and I still have not felt the low heart rate. I quit wearing a monitor at night because I kept waking up in the morning and looking at it and was worried, I dropped down into the 30s last night. It kept going like that. So finally, I just quit wearing it. I said, hey, I don't feel anything. I feel great. I can do what I want to do. So I don't worry about it. I pay attention, but I don't worry about it.
I heard someone say once that if one person has some sort of sleep disorder, their partner has the same disorder because they're not sleeping well either. Is your wife sleeping better now that your sleep apnea is being treated?
Fortunately, she's always slept well.
She slept right through it?
She sleeps right through it. She don't move. She sleeps in one spot. I'm the one that is all over the place. And but she hasn't really noticed much difference.
Okay, well that's good. You're a good pair then. Yeah, and plus you said, did you say you drove 800 miles? You're the driver of the family on all your trips. I mean, that's a good partnership.
Yes, it is. She does not enjoy driving. She loves to go, but she just really does not enjoy driving, and especially since I pull a trailer. She just as soon sit back and enjoy and look at the scenery. She picked out a small deer that were sleeping next to a stream, and I got some really good pictures of a couple of deer.
Oh, that's sweet. Dr. Luthra, I want to ask you about the different types of sleep apnea. You said Joe has central sleep apnea. Is that the most serious one?
So the seriousness of the apnea depends upon a number of factors: how many events you're having per night, how does it impact your oxygen levels, and what other health conditions you have. But there are basically three types of apnea. One is the obstructive apnea, which is more common, which is due to mechanical obstruction in the airflow. The other one is the central sleep apnea, which Joe has. And then there could be a complex or a mixed apnea where you have elements of both obstructive and central disease. And then there is a fourth one, which is not very common, which is high altitude periodic breathing. So if somebody goes to Colorado and is on 8,000 feet, their breathing may start to stop at night. And that's what we call a high altitude periodic breathing, which is also a sleep-related breathing disorder.
We want to go to some questions from our viewers because we have the questions rolling in. And we have Yen Liang and Laura both asking similar questions. Laura wants to know, Dr. Hughes Thompson, if poor sleep leads to high blood pressure. And then Yen Liang wants to know if your chances of suffering from a heart attack are greater than the general population if you have sleep apnea. And you talked about that a little bit.
Yeah, again, it's kind of a underlying condition that drives, then high blood pressure drives arrhythmias. And then we know once we see those issues that the risk for stroke, the risk for heart attack, and heart failure are clearly increased. So sleep apnea is connected to those things. And more importantly, it is something we can manage and treat and continue to do more and more amazing things for. So I would say, yes, there's a connection. And more importantly, hey, we can identify it and we can treat it.
You can treat it. Joe, Jill has a question for you. Jill wants to know what it feels like sleeping with that device that you wear.
In the beginning, until I've had a mask that fit properly, it was the sleep study, it was a problem. Once I found the mask that I liked and it fit well, I have really have not had much of a problem. I pull it tight. The tighter it is, it don't move around on my face. I also have the host going up over my head rather than trying to come in from the side of my face, because as you roll, if it's on the side, you roll that way. I found if I just let it run straight up over my head, it works out much, much better.
So it's about positioning as well. John has a question for Dr. Luthra. John wants to know if sleep apnea is different than just really bad snoring.
Yes, so snoring is noisy breathing. So your breathing can be noisy, but that does not mean that the breathing is actually stopping at night. And if somebody is snoring loudly and they don't sleep well, then they should get a sleep study because snoring is associated more with sleep apnea. So sleep apnea would be when the breathing actually stops significant number of times and it is also dropping your oxygen at night. So that would be the difference.
So if you don't have anyone to tell you that you're snoring, do you just have to rely on feeling tired in the morning and that's your cue to go? Because a lot of people feel rotten in the morning. Mm-hmm. So how does a regular person who maybe lives alone, that doesn't have any pre-existing conditions that they know of, how do they know they need to get a sleep study?
I think if your sleep is poor, and poor could mean many things for people, but in general for sleep apnea, patients go into sleep okay. They initiate sleep fine, but they don't maintain sleep. So that means they are waking up, the sleep is fragmented. And when they wake up, the other clues can be you have a lot of dry mouth, sometimes sore throat, you take a big glass of water right away after waking up, and you feel some heaviness in the head or feel extremely tired. Those would be your clues. So fragmented sleep, dry mouth, tired, and then talk to your doctor about a sleep study.
Dr. Hughes-Thompson, Nick wants to know how often you send your patients to sleep specialists, or is it that you find the sleep specialists are sending their patients to you after they have a study?
I think you can go both ways. I do think it's more physicians like myself, cardiologists, general physicians, sending their patients to the sleep specialists more than they send to us. But it definitely can go both ways. It's a two-way dynamic.
Jamie wants to know if heart damage from sleep apnea can be reversed.
Truly reversed, I think more than anything else, it's stabilized and it doesn't progress, which I think is always the thing. You know, sometimes there is some residual effect, but I think for the most part, is when you manage something and can manage it as well as we can manage sleep apnea, clearly people do better. And when you stabilize a condition, and I do think there's a certain level of reversal or stability that develops, and I think that's probably really what has the impact.
When it comes to detecting sleep apnea, Tori wants to know, Dr. Luthra, can your smartwatch detect sleep apnea, or is that strictly a sleep study you need?
So right now, the FDA approval is for the home sleep apnea tests for detecting sleep apnea, but we are making a lot of advances in smartwatches. I think if you look at the three big players, Apple, Garmin, and Fitbit, they can record blood oxygen levels. And if your blood oxygen levels are dropping number of times at night, that could be a surrogate marker for having abnormal breathing. So you can get subtle hints from these devices that, you know, your sleep stages are bad, you are waking up a lot at night, and your oxygen is dropping quite a bit at night. That could be a hint that you have apnea, and then you need a more formal testing. We're not at a point yet where we can diagnose apnea from a smartwatch.
Okay. And then Leslie has a personal question. She writes, I find myself waking up a lot at night and I do snore. So when do I know if I need to see a sleep specialist?
I think this would be the right time.
This would be it. And
if you're snoring and you're waking up, I think the earlier the apnea is detected, think of apnea as diabetes or hypertension. Is it bad to detect diabetes when you have pre-diabetes? No, there's no the earliest you detect these chronic conditions, the lesser impact it has on your organ systems. And then we talk about that reversal. So we don't want to reverse things. We want to prevent things. So nowadays with preventive medicine, if you have symptoms of waking up, snoring, get a sleep study done. The earlier you do something about it, 10, 20 years down the line, you are preventing a lot of chronic conditions with your brain, your heart, and your immune system.
I want to keep our entire panel up for some final thoughts. And Joe, I want to start with you. Now that you've come out on the other side of this tunnel, what would be your message for other people watching?
I would say do it as early as you feel. I probably would have had this done earlier. I never have snored. So until they found the problem with the low pulse rate and the problem with when I had my knees operated on is when they really started finding the problem with the sleep apnea. I would say get it done as soon as possible. Stick with it. If it don't work the first time, go back, keep at it. I feel so much better. Like I said, I don't need an afternoon nap. I can drive basically all day without problems. It has made a big difference in my life.
That's wonderful. Dr. Luthra, what would your message be?
So I think my message every time I talk to patients is let's not think sleep is benign. Sleep for a very long time has been thought of a benign thing, a quality of life metric. You don't sleep good, you feel tired, that's a bad quality of life. But it's beyond that. We now know that sleep is intertwined with your endothelial function, the way the blood vessels work, the way the inflammation increases in the body if there's poor sleep, the immune system, the heart, the brain. So do not discount bad sleep. The body is designed evolutionary wise to have a good sleep, and if the sleep is not good, there is something going on, and talk to your doctor about it. Doesn't have to be a sleep medicine specialist. Talk to your primary care about not sleeping well, and then get to the bottom of why you're not sleeping well.
Dr. Hughes-Thompson, to go right on what Dr. Luthra is saying, it affects everything, and heart very specifically. What's your message?
Yeah, I would say I'm very enthused about what we can do for sleep apnea. It truly is a game changer for patients, for patient care, and for doctors. And seeing how far it's come, again, in my time of practice is amazing. And people accept it now, which is great. I mean, you can start a conversation when you're having coffee or when you're talking to family members and friends about how many people really do deal with this condition and how effective the treatment can be as far as changing how you feel, how you function. And oh, by the way, you talk about prevention. Prevention is always the best medicine, and dealing with sleep apnea earlier and often really has an amazing impact. So do it.
Well, Joe, you're a textbook case of how great it works out when you deal with that problem. Thank you for sharing your journey. And doctors, we are not done with you yet. We know you do incredible things here at the health system, but people always want to know what our doctors are like outside of work.
Now for a secret look into the guardians of healthcare at the University of Kansas Health System. Let's go behind the mask.
We're going behind the mask, starting with Dr. Saurav Luthra, and we have some really cute pictures of your family. Tell us who we're looking at, Dr. Luthra.
So this is my picture with my toddler, Ranveer, and my wife, and she's also a cardiologist, by the way.
Oh my
And
gosh,
so we were just hanging out. Yeah, this is one of the better evenings when we're both free and we can take him out to the park.
Okay, speaking of sleep, so we have two doctors in the house and a toddler. How do you sleep?
Well, no matter how good of a sleep physician you are, when you have toddler or a young one, your sleep is fragmented. But it is a temporary phase. You have to understand how the sleep changes as the kid is growing. So now my son, he sleeps through the night well. So both of our sleeps are a lot better now. And we're thankful for that.
What's it like being married to you? Like, are you always looking at your wife as she sleeps, watching her sleep, studying her sleep? Is that something that
I think
always on your mind?
I think I cannot help. Yeah, I cannot help not look at that. So with my kid, I was looking at his sleep patterns and making sure he's getting proper sleep training. If he would have any snoring, then I'm, thinking, is his tonsils getting bigger? Do I need to check on that? I don't try to make it obvious, but yeah, in the back of my mind, I am analyzing people's sleep.
All the time. I want to get to Dr. Shannon Hoos-Thompson next. We know you're a huge sports supporter of women's sports. You played softball at Creighton. We know you love to decorate, but we didn't know until today that you have a bit of the travel bug as well. You just went on an incredible trip with your daughter. Tell us about that.
Had the amazing opportunity to go along the Mediterranean coast, and obviously with my daughter there, see amazing places, spectacular cultures, and then the people we were with was just made it all the more wonderful. So yeah, one of the best trips I've ever been on, and what made it so great is obviously the places, but just the people was awesome.
Does your daughter have any interest in following in your footsteps and also becoming a doctor?
Not that she's hinted to or made me aware of, but I guess that teaches us both something. I think I'm a good parent as far as she's making her own decisions about who she wants to be, if she wants to do it.
Oh, that's wonderful. We love seeing those pictures. And then when you go on a long vacation, do your patients start clamoring for you? How does that work out? How do you shut that part off?
I try to make them a little bit aware. Medicine is about a team. I have wonderful nurses who I'm surprised they always joke that they're going to step in and photobomb this, but they don't. They're out there working right now, have wonderful partners, and so I trust and rely on them, and likewise I hope they feel the same way about me. It does take a team. If you're going to have success in any career, but especially medicine, it takes a team, and being able to talk to people like Dr. Luthra and get his expertise and understanding, and then knowing that we all have that common background of passion for medicine and learning and growth. And so I rely on my team. I love my team. I'm very fortunate to work with the people I do.
I can hear the athlete in you coming through. You're always a team player. From Creighton to the University of Kansas Health System, right? While we have you here, I do want to ask you a question about a new study just released about sudden cardiac arrests, because it turns out they might not be so sudden. The study from the Lancet Digital Health Journal found 50% of people with sudden cardiac arrest had a telling symptom up to 24 hours before. And according to this report, Dr. Hoos-Thompson, it's different for men and women. This report says for women, it's shortness of breath. For men, it's chest pain and pressure. The U.S. National Heart, Lung, and Blood Institute says 450,000 Americans die every year from a cardiac arrest. So what do you think of this study as far as women having different symptoms than men?
I think that gets overly brought up. The most common presenting symptom, that's what I'm going for, in men and women is chest pain. It is. How you describe it may be a little bit different if you're a man versus a woman, but it's still chest pain or really a profound shortness of breath. It's like, oh, I couldn't get my breath. It's a profound shortness of breath. So it's more of a descriptor than a true difference, is I think how you should think about it better. And as far as the study, it is retrospective, so they're looking after the fact. So we are trying to understand who's at risk and can we identify them to prevent the event or do a better job of getting them through the event if it does happening. And this study is retrospective, this information, and we've had that information, but how do we take that 2020 hindsight and move it to foresight? That's really where it takes us and where we're trying to get.
Thank you for your expertise, and thank you for carving out time to be with us today, doctors and Joe. It was great talking to you. Coming up next week on All Things Heart.
Fluttering in your chest to the point where I would get like a cold sweat, and I felt like I was immediately going to pass out.
That flutter kept coming back, and it turned out to be the key warning sign that saved her life. Wait till you see what happened next. It's something we all need to know about, and that's coming up next Thursday morning at 8 a.m. on All Things Heart. Coming up Friday on the Morning Medical Update. An accident might have taken away his mobility, but this man wasn't about to let it take away his ability to compete or start a family. I'm Alexis Del Cid. On the next Morning Medical Update, the Kansas City Chiefs para-athlete and his journey through fertility treatments here at the University of Kansas Health System. Friday at 8 a.m.